We will begin today's hearing with LB367. Senator Hunt.
Hi, everybody. Greetings. Good afternoon, members of the Health and Human Service Committee. I'm Senator Megan Hunt, MEGANHUNT, and I represent District 8 in the northern part of Midtown Omaha. I'm here to present a bill that is a personal passion project of mine. I've worked on this bill since the beginning of my time in the legislature. I think I've introduced it every year that I've had the opportunity to. And I'm really hoping we can close the book on it here in my final biennium, or else I'll pass it off to someone else and you can keep working at it for another however many years or however long it takes. But this is an important issue to me. The first time I introduced this bill, I think the hearing went until nearly midnight, and an opponent who attended from Texas stood up and yelled at me, and then he almost got in a fight with Senator Justin Wayne, and it was much more of a circus than we're probably going to have today. So I thank the committee for rescheduling this hearing because of the blizzard last week, and I'm appreciative to all the testifiers who were able to come. LB367 is a bill that would end the harmful, widely discredited practice known as conversion therapy for minors and bar the use of state funds for its use. Conversion therapy is a long-debunked pseudoscientific practice used by unscrupulous providers in an attempt to change a young person's gender identity or sexual orientation. The therapy employs a variety of shaming, emotionally traumatic, or physically painful treatments to make their victims associate those stimuli with their LGBTQ identities. It is practiced by some licensed professionals in the context of providing health care, as well as by clergy or other spiritual advisors. Throughout recent history, techniques have included institutionalization, castration, forced sexual interactions, lobotomization, electroconvulsive shock therapy, and talk therapy. Regardless of the method, whether you're castrating somebody or giving them electroshocks while showing them gay pornography, or whether you're just doing talk therapy, these treatments have proven to be ineffectual and harmful. Since the 1990s, the American Psychological Association has recognized that conversion therapy causes severe psychological distress, trauma, and long-term emotional harm among young people. Conversion therapy is based on the false premise that being LGBTQ+ is a disorder or a disease that needs to be cured. The practice has no scientific basis and has been discredited by all major medical, psychiatric, psychological, and professional counseling organizations. The American Medical Association supports state and federal bans, and the American Psychological Association states that there is no credible evidence that mental health interventions can change someone's sexual orientation. The practice almost never has the intended result of changing anyone's orientation or identity, but instead invalidates a person's identity, fostering lifelong shame and internalized homophobia or transphobia, which has devastating consequences. Survivors have increased likelihood of experiencing depression, anxiety, drug use, homelessness, and suicide. Those who have gone through conversion therapies, including here in Nebraska, speak of the medically unsound methods employed by these therapists and organizations, such as behavioral therapy, electrical shock therapy, chemical aversive therapy, drug and hormone therapy, and surgery. These treatments include homophobic counseling, isolation, unnecessary medication, including hormone treatment, subliminal therapies designed to enforce feminine or masculine behavior, and desensitization therapies that teach a young person to associate homosexual feelings with disgusting images. These forms of treatment frequently result in nervous breakdowns and feelings of guilt. Some patients have witnessed others in their programs commit suicide and mutilate their bodies and genitals. Many of these tactics cause mental breakdowns in otherwise healthy people. This bill would ensure that vulnerable youth are not subjected to this unethical and dangerous practice from a licensed provider under the guise of an accepted medical treatment by making it grounds for disciplinary action under the Uniform Credentialing Act. That is, if any of the medical or mental health providers licensed by Nebraska under this act, such as a licensed psychologist, counselor, therapist, nurse, or doctor of any kind, were to administer conversion therapy interventions on a minor patient, it would be grounds for disciplinary action against their license, and the patient could have a legal claim against them for deceptive trade practice and could seek remedies or penalties under the Uniform Deceptive Trade Practices Act. I want to highlight an important exception. The ban language in the bill includes an explicit exception on page 6, beginning on line 30, that it does not apply to practice or treatment conducted by a clergy member or religious counselor who is acting in a pastoral capacity and not in the capacity of a licensed healthcare professional. I felt this was appropriate to include if there are circumstances in which a family makes the personal decision to inflict this kind of trauma upon their child out of a sincerely held religious belief. So if a faith leader or a youth group leader or spiritual advisor or something like that wants to have discussions with a young person about changing their identity in some way, they would still be able to do that. But I do think we have the responsibility and authority to say that when we are vetting and providing oversight over our credentialed healthcare professionals, the state has a role in ensuring that they are providing healthcare in line with evidence-based best practices when care is provided in a professional clinical setting. I know when I go to the doctor, I don't want my physician using treatments on me that lack supporting evidence of any effective results, which is known to have harmful effects on patients, but which they might want to try because it fits within their personal belief system. I would run away from that doctor. We all would. We put our trust, Nebraskans put our trust, in our licensed providers, and by extension, us as state government leaders, that we are doing the necessary vetting and regulation of those providers to ensure that they are using credible treatments. It is our duty to provide appropriate disciplinary sanctions as well for bad actors in the healthcare field. You'll see the bill has no fiscal note, and we have a wide range of support from counselors and various types of psychiatrists and mental health practitioners from across the state. I'm afraid not as many of them are here as who originally wanted to speak because of the rescheduling and the weather, but I believe many of them did submit comments online. And there's also, as I mentioned in my very beginning of the opening, many, many years of testimony from Nebraskans that we can pull from as well. It's important to highlight that all of the national standard-setting organizations for the major physical and mental health professions have issued statements in support of conversion therapy bans. The National Association for School Counselors, Pediatrics, Psychologists, Physicians, Nurses, and Social Workers have all asserted that conversion therapy goes against their professional codes of ethics. The American Psychological Association has repeatedly condemned this practice for its lack of scientific basis and its potential to cause lasting harm, such as increased rates of depression, anxiety, substance abuse, and suicide. LGBTQ people have been in the crosshairs nationwide and in this legislature. That is a fact, whether you are a person on this committee today that is supportive of the policies we've reckoned with to legislate their rights or not, and you cannot ignore or dispute that. If you asked any LGBTQ person in Nebraska, they would tell you that Nebraska is an increasingly hostile place for them to live. Of course, there are pockets of strong, vibrant, diverse, accepting communities, and I'm very proud of those bright spots in our state. But to be a queer person in Nebraska or in this country is to question your future, your safety, your rights, and your children's rights. In this legislature in the past few years, we've seen unprecedented attacks launched against the queer community in the name of protecting women or children. This year, we will debate again a bill from Kathleen Kauth to isolate and demonize queer youth from feeling safe in their own schools with their own friends. I'm here with a solution that is factually about protecting these children, which is evidence-backed, supported by all legitimate major medical, psychiatric, and pediatric organizations who have all firmly stated that conversion therapy is dangerous for minors. Conversion therapy itself does a lot of harm to its victims that can stick with them for life. That we in the Nebraska legislature have failed to act on this issue undermines a message of equality and acceptance in Nebraska. With bills like Senator Kathleen Kauth's LB89, we continue to perpetuate stigma and discrimination. We keep telling anyone who is young, who is smart, but who is part of a forward-thinking or marginalized group that we don't want them here. Colleagues, I'm afraid we've done a lot of damage. In my committees, we've been hearing a lot from young people who have told us that they are already making plans to leave. But we can reverse course, and this is one way to do that. This is one small part of that. By passing LB367, Nebraska will affirm its commitment to the health, safety, and dignity of all residents, ensuring that every individual can live authentically and free from the threat of conversion therapy's effects. Thank you very much. I'm happy to answer any questions.
Thank you, Senator Hunt. Are there any questions from the committee? Senator Eby.
Thank you, Chairman. Thank you for being here. I don't want to delve in immediately to the merits or otherwise. Do you have a roadmap to take this to a governor's signature? I mean, in the sense of, I assume it doesn't have a priority, and I assume that you maybe are then looking at amendment onto something. Is that your thought process to help us?
That is my thought process. I've prioritized this in the past. This year, my priority bill is actually coming out of this committee as well, and I thank you for your support. This bill, I think you should vote it out, and we can find a home for it on another bill. Or perhaps it'll be my priority next year. And if that's the case, I don't think we need to wait to next year to vote it out.
Okay. Thank you. I will probably want to come back with some more questions as I learn more. Thank you, Chairman.
Thank you, Senator Eby. Other questions from the committee? Seeing none. Thank you for being here.
We had online proponents 160, opponents 84, one in the neutral. Welcome back, Senator Hunt.
Thank you, Chairman Harding. As you heard from proponents of the bill, 28 states and DC have passed bans on conversion therapy like in this bill. When I first introduced this bill, 13 had, and now we're up to 29. And there are also a number of countries that have bans on conversion therapy. I would like to share some of them with you. Belgium, Canada, Cyprus, Ecuador, France, Germany, Greece, Iceland, Malta, Mexico, New Zealand, Norway, Portugal, Spain, Albania, Brazil, Chile, India, Israel, Taiwan, Vietnam, Argentina, Fiji, Nauru, Paraguay, Samoa, Switzerland, Uruguay are some of the countries that have banned conversion therapy, this practice. The thing with this bill is it just says that if you'd like to operate with a professional license in Nebraska, that you're going to uphold the standard of care as is the consensus of your organizing industry, so is that the American Medical Association, the Psychological Association, Pediatric Association, whatever. It's just saying if you'd like to hold a license in Nebraska as a therapist, as a doctor, as a counselor, what have you, you could not be telling kids that they're sick if they're gay. We're not talking about First Amendment issues here. From what I heard from the opponents, which is the same thing we hear every single year, they really don't know how therapy works. There's nothing that would be happening. I can tell by the conversations here, by the questions from committee members, by the opposition testimony, we've got a lot of people who've never been to therapy, who are not conversant with what the standard of care in psychotherapy actually is. And that's okay, but we cannot be legislating from a place of ignorance. And we not only have, what did I read off? 30 plus countries, nearly 30 states, 60 plus counties and municipalities that have banned this because it is against the standard of care as agreed upon by every major medical association. The way this bill is written, the conservative way for all of you, is to say that pastors, clergymen, whatever, you can still tell kids that they're going to hell if they're gay. Parents can still take these kids to the pastor and say, I think my kid's a homo, can you beat it out of him? That would be okay to do under this bill. But what you cannot do is hold a credential in the state of Nebraska, hammer that to your wall, and say, I'm providing a legitimate service, because you are not. It is not the standard of care in any way as recognized by any organization. The bans, speaking about the First Amendment issues that were brought up by opponents, the bans target the conduct and the speech of licensed professionals. It doesn't limit free expression at all. It's just targeting the conduct. And courts have found that regulating professional behavior when it comes to public health, when it comes to public safety, it's well within the right of a state to do that. It's not okay for any doctor or healthcare professional to give their patient advice that not only goes against the standard of care, but could actively harm them. That's not a free speech issue. And, you can look at page 6 of the bill, where a lot of the meat of the bill is. And this was added to the bill the second time I introduced it. Conversion therapy does not mean a practice that does not seek to change an individual's sexual orientation and that is neutral with respect to sexual orientation and gender identity, provides assistance to a patient undergoing gender transition, provides acceptance, support, and understanding to a patient or client. Again, this is just speaking to the nature of what therapy actually is, which it sounds like a lot of people don't understand. It is always okay to give exploratory, affirming, neutral care to your patients. I don't think it's a secret. All of you know that my child has been through all kinds of therapy, talk therapy around gender identity and sexual orientation. And at no point would a therapist ever say, this is what your gender is, and we're going to get you puberty blockers, and we're going to get you surgery, and we're going to get you hormones, and I'm going to affirm that this is what your gender is because I'm telling you that's what it is. That's not the role of a therapist. And you guys don't have to worry, and opponents don't have to worry, because licensed credentialed therapists in Nebraska know that that's not their role. Attorneys for the Family Institute, whatever, they are not the experts in psychological health care. Psychological health care people are. To Senator Myers, I have a couple responses to a few questions that came up. Often, and also Senator Reapy talked about this, some kids do want this. Some kids do want to go to conversion therapy. This bill would not prevent adults from going to conversion therapy, by the way. Some kids want to, and it's because they have so much confusion and self-loathing because they've been raised in a culture or a church or a family where they understand that it's a bad thing to be gay. And so they would do anything to not be that way so that they can be accepted by their peers and their teachers and their friends and their parents and their pastor. It's a tale as old as time. You guys know this. You know that that's what kids go through. And it's abusive. And all a therapist does is affirm that kid, give them a safe space to explore their feelings, and maybe they do conclude that they're not gay, or maybe they conclude that they are. But what we cannot allow is for credentialed therapists in Nebraska to hide behind their license and say, I'm going to prevent you from being gay because that's my ideology. That is something pastors and priests and clergy members can do under this bill, not people who are licensed mental health therapists. This is something that comes from the era of lobotomies, the era of institutionalizing people for deviant behavior, the era of disappearing people who are too queer. This has nothing to do with the standard of care today. And there's no diagnosis that's recognized today that conversion therapy would be the treatment for. It's pseudoscientific, it's debunked, and every major medical association agrees with that. Thank you, Mr. President.
Questions? Seeing none, thank you.
Thank you.